Great. Well, good evening, everybody, and sincerest welcome to this evening's BioInnovate Information Webinar. Brendan Boland's my name. I will be talking you through some of the key points today. We will then have some interviews from past fellows as well as an open Q&A session. Just to let everybody know that this evening's webinar is being recorded, so the information will be available to people who aren't able to make the webinar this evening, but you hopefully should have gotten that notification already. So thanks so much again for your interest in the fantastic BioInnovate programme. BioInnovate has supported under the Innovators Initiative programme, which is co-funded by the Government of Ireland and the European Union through the Northern and Western Regional Programme. And it's through this support that the really interesting, exciting and very successful BioInnovate programme can be held. So, as I said, Brendan is my name. I was a BioInnovate Fellow 2013 to 2014. My background is as a clinician, a doctor who practiced for 7 years before doing the BioInnovate programme. And to be totally honest, BioInnovate had a massive career impact on me. I thought that I was going to go back to clinical practice with the learnings from BioInnovate, but now a number of years later, I'm a co-founder and executive chairperson of an orthopedic medtech spin-out. We've raised over 22 million euros currently in clinical trials and have recently a significant Series A, which includes one of the world's biggest medtech companies. So going into it, that's not where I expected to be, but coming out the other side, as you can tell from the fact that I'm hosting the webinar today, I'm a massive fan and a real proponent of the BioInnovate programme. So I guess what I'm hoping by the end of the webinar is that everybody who's tuned in this evening will be absolutely convinced to apply. So obviously you don't want to hear me talk the whole way through, but what I will be trying to give is a good background on the actual fellowship programme itself, what BioInnovate is and what biodesign is and what the biodesign process is and the timelines. As a clinician, as a scientist, success is all about evidence base and key performance indicators. You have to prove that something is worthwhile. So I'm going to talk a little bit about the success of the program and really the proof of how successful it has been. In my mind, it's an absolute no-brainer. Everybody who's taken the time to click on the link this evening on a Tuesday evening about this information webinar should apply. There's no reason why you shouldn't apply. If you've already had this level of interest, I would really strongly recommend that you go ahead and apply, and hopefully by the end of the webinar, you'll be even more enthusiastic about that application process than you are at the moment. As I say, you know, an N of one, so one person telling a story isn't always very useful. So that's why I'm being joined later on in the webinar by Dr. Áine Rafferty, Stephen Geoghegan and Sarusha Pillay, all of whom are going to tell really interesting background stories as to what they've gotten out of BioInnovate. So you can see that fellows who've completed the BioInnovate programme have had phenomenal success across various different disciplines and in various different forms. To close out the webinar, we'll be joined by Ailish Walsh, Professor Martin O'Halloran, and Dr. Sinead Walsh for an open Q&A session. So within that context, as in over the course of the webinar, you can click on the Q&A section. The Q&A section, as we run through various different elements, you can drop in your questions there. Ailish will very kindly answer all of the questions that she can while the webinar is running. Some key questions she may leave until the end. So if your question isn't being answered in real time, it may be the case that it's a very important question that may be relevant to a lot of people attending the webinar this evening and hence is being left to the open Q&A. If you prefer, you can wait until the end of the webinar and then add in your own question in the Q&A section, which will be again facilitated by Martin and Sinead. So that's a general overview of what we're hoping to cover this evening and obviously the enthusiasm that I think we're all trying to bring to the BioInnovate process. So ultimately, I guess one of the core questions for those of you who mightn't be as familiar with the program as others is who we are. So ultimately, BioInnovate sits at that really impressive, clever and impactful junction of industry, academia and clinical. Really, BioInnovate is a 10-month program, and it's all about educating the next generation of healthcare visionaries. So this is kind of a very broad term as to what a healthcare visionary is. So a healthcare visionary obviously is someone who can see an unmet clinical need, work to find an unmet clinical need, solve that unmet clinical need, and really impact the lives not only of current patients, but also of future patients. This can obviously be done through an entrepreneurial element. Now, entrepreneurism is a very wide word, as in that might mean someone like myself who has, gone the whole startup route and raised money and gone that element of a spin out and whatnot. But entrepreneurialism can be in-house and also as in within a startup. So some people have gone back into industry and brought that entrepreneurial spirit back in, or into academia. The core element of all of this is really the final three words, which is to impact lives everywhere. So BioInnovate is a very well connected international program. We're not just trying to improve the healthcare of patients locally, we're trying to actually improve the lives and the health of patients globally. And by doing so, we're really trying to, move the needle on treatments, not just iterative slight improvements, but really coming back to the core unmet clinical need so we can impact as positively as possible as many people as possible. And that's the really exciting thing about BioInnovate. Now, BioInnovate was established in 2011. So it has a good long history at this stage. And as I said, the purpose is really to train the future innovators and embed the medtech industry in Ireland. So we'll hear a little bit later on about how medtech is already a powerhouse within Ireland, but really as in BioInnovate is trying to build our own increased medtech ecosystem. To that end, while it is based at the University of Galway, it is a national programme with reach across several of the universities as well as the hospital systems. Of note, BioInnovate is the only European affiliate of Stanford Biodesign. Now, Stanford Biodesign is a system whereby unmet clinical needs are identified, a solution is invented, and then we implement that solution. In terms of medtech and medical technology and medical inventions, biodesign has probably been one of the most impactful design processes ever developed. And like that, the fact that BioInnovate is the only European affiliate means that participants on the BioInnovate Ireland programme get a very strong link with the Stanford programme as well as the other Stanford programmes across the world. So while like that, as in BioInnovate is based in Galway, it is a national programme, but it also has global reach. So to the point of being based in Galway and being based in Ireland, about 450 medtech companies exist in Ireland, which is a phenomenal amount, really, given the size of the country. 17 of the top 20 global medtech companies are based here, and it's the second largest exporter of medtech products in Europe. So to that end, as in you can see on the right hand side of your screen, how obviously Galway, Limerick, and Cork. But throughout the whole country, there are dotted these really exciting medtech innovative companies that are all working to really improve the lives of patients. To that end, 38,000 people in Ireland are employed in medtech, and we're the fifth highest in the world for medical patents per capita. So as you can see, being based as a national programme on the island of Ireland already has one embedded within the ecosystem. Within the BioInnovate context, which is housed in the University of Galway, Galway obviously being a really strong medtech hub in its own right, the BioInnovate programme is really well located on campus in NUIG. The reason being, as I said in one of the earlier slides, as in we sit at that really interesting and impactful junction of clinical, academic, and industry. So right next door is Galway University Hospital. Now, BioInnovate fellows also travel to other hospitals, but having a university hospital on the doorstep is a phenomenal support. Going back to first principles, we're beside the human biology building, as well as from an academic and an industry point of view, the Research and Innovation Centre. We also have the business school looking at that kind of industry and funding mechanism, as well as more recently, our connection obviously with the Data Science Institute, which has become really impactful with the changes of AI. But having said that, we also like to work hard, so the college bar isn't too far away. One of the really interesting things about the BioInnovate program, and I think it makes it stand out from potentially other programs, is the BioInnovate team. So as you can see on the screen here, Professor Martin O'Halloran, Professor Mark Bruzzi, Professor Faisal Sharif are all program leaders. Now, they've all been involved in, started their own medtech companies, acted as advisors for their medtech companies, have exited medtech companies. The program leaders in BioInnovate have the lived experience that people on the program need. This isn't a solely academic program. The people on the program and the directors know all of the pain points of starting a company, spinning out, or bringing a new technology to clinical practice, or making academic research into a company. So, there's an old phrase in medicine called see one, do one, teach one. And this is very much the program team where they're speaking from experiential learning within their own right when talking about how to really be a healthcare visionary, how to have that entrepreneurial spirit, and fundamentally how to really positively impact patients' lives. Supporting the team as well is Anne Byrne, Dr. Sinead Walsh, and Ailish Walsh, all of whom are absolutely super. The program in itself will do its utmost to facilitate the best candidates. So over the course of the webinar this evening, while you might hear me talk about various different elements of, how things work, go ahead, click the apply button, because really the program are as flexible as they can possibly be to try and support the optimal candidate. So again, great reasons to apply this evening. BioInnovate, obviously, we're talking this evening about the fellowship program for entrepreneurs, which is the 10-month program. But of note, BioInnovate now also does training and innovation for industry, works with medtech companies, as well as medtech skillnet. So not only when you start the BioInnovate program are you surrounded by a really supportive team in a really great local ecosystem, but also a BioInnovate program which links in with existing medtech companies. So you have this fantastic ecosystem of industry, academia, clinicians already built to really make the most out of the 10-month program. So speaking of the program itself, 12 fellows will be chosen. It's an incredibly competitive program to get onto, but please don't let that turn you off, or don't apply because it is so competitive. The reason being is that the teams are really optimized, and that has a multiple elements to it. So there's 12 fellows chosen, 4 on 3 teams, so 3 teams of 4. Generally, each of the teams of 4 is made up of one technical person coming from a background in engineering and science, a clinical person such as myself, a commercial person, so kind of bringing that business element, so that kind of industry, academia, clinical element within the team. But then there's another person. So as in that can come from any discipline. And we've seen people come from big data, we've seen people come from marketing and sales. The other element can come from anything, as well as the commercial element, clinical and technical, can be chosen within various different categories as well. So it's all about putting the optimal team together so everyone gets the best experience and the best outcomes. Now, each of the 3 teams is then given an area of clinical focus. This is chosen by the program. Part of the reason being is that it's all about educating in the process. And that's very important because it's not just about, going into an area that you have experience in. It's about learning the process so that process can be applied again and again and again. Of note, a scholarship is provided of up to €38,000. Now, I think Martin and Sinead might talk about this a little bit later on, but generally that scholarship isn't taxed, so it's equivalent to about a €68,000 salary based on current Irish taxation systems, and it leaves your tax in a pretty good position from the year going in and the year coming out based on tax credit. So to be totally honest, as in it's a phenomenal opportunity that fellows get. You get to work with really cool, ambitious, educated, experienced teammates in a multidisciplinary team that you wouldn't necessarily get to ever meet otherwise. You get a new area of clinical and strategic focus that's chosen partially because it's an exciting or a growing area in medical technology, and you get paid for it. So, it's an unbelievable opportunity that I think everybody should really be grasping for. So, as I said, please do kind of go ahead and have a look at the application process so that you can learn this BioInnovate program and the bio design process. obviously, as in the biodesign process is based on three core tenets, which is identify, invent, and implement. So the identify phase is identifying an unmet clinical need, a huge unmet clinical need that really impacts the lives of patients, and particularly one that may not even necessarily be currently recognized for the huge unmet need that it is. You then go ahead and try and invent a solution. So unlike other programs, BioInnovate and BioDesign is very much a market product fit where you find a huge market and then develop a product, as opposed to other programs which kind of look at a product market fit where you have a product and you're trying to figure out what to do with it. This is really blue sky thinking, and this is where, you know, the companies that are coming out are really impacting healthcare. So like that, as in it's all about learning the identify, invent, and implement process, which you can then bring forward to, you know, impacting positively on healthcare. As I said, the team structure is usually kind of clinical, engineering, commercial, and then anything else, so data, etc. The clinical areas like that is it can be based on investor trends, areas up for new innovation, but also as well good access to clinical immersion and clinical champions, which really is one of the core elements as to why people should do BioInnovate. This is the timeline of how your 10 months would run if you're fortunate enough to get a position on the fellowship. So like that boot camp starts in August. This is a rather intense month-long boot camp where you get to really kind of figure out that biodesign process of identify, invent, and implement. But the really interesting part is the clinical immersion through September and October. So you get arguably unparalleled clinical immersion. So you get to really get into all the clinical situations, talk to clinicians, talk to patients, talk to all of the end users, key stakeholders. For those of you who maybe are in a clinical background, it's such a different experience. You get to be a fly on the wall again. For those of you perhaps coming from a commercial or a technical background, you know, it's extraordinarily rare that you get such good clinical access. And it's only really with that 2 months of amazing clinical access that you can find really huge, impactful, unmet clinical needs. Once you've found some of these needs, you then screen them and validate them before in the turn of the year towards January and February, you then kind of start looking at, well, hey, how can I fix this? Or how can I solve this huge unmet clinical need? Which is the really, you know, it's a really exciting part because you're working with a team who are coming from really different backgrounds, really great experiences. So, you know, you again can come up with a product or a solution in any way, shape, or form that you want to. There are no bounds held within it. And then obviously you move on towards March and April as to how you could put a kind of business case around this. So if you have a huge unmet clinical need, possibly a way to fix it, how does that stack up on a business case so that by the time you get to April, you know, you have a huge amount of information, you've learned the process, and you potentially have a business case which you can take forward. And the final cherry on the cake is that you then have the opportunity to choose to go forward for either a diploma or a master's dissertation to add an additional qualification to your CV at the end of it all. But trust me, I think by the time you get to April, you'll probably be so enthused about solving your unmet clinical need that you'll probably want to jump on with that as fast as you can. Finally, as in one of the things that I again spoke about is, you know, the evidence base behind this. So, you know, on screen at the moment are just some of the companies that have come out of BioInnovate. And some of these are second go around. So Embo, the folks that did Embo have now, that was acquired and they've now started Perfuse. You know, people are on their second companies out of this. Loci Orthopaedics is mine, and we're trying to solve major unmet clinical needs in, you know, vastly different areas of clinical practice, but all of which are having huge impact on patients. So as you can see, about 370 odd patents have been granted. Over 8,000 patients have already been treated by BioInnovate spin-out companies, the 23 companies that have already spun out. In terms of funding, BioInnovate companies have raised 312 million to date. So like a third of $1 billion in funding, which for a country the size of Ireland is huge, really. 1 in 4 BioInnovate alumni are female founders, and 1 in 8 medtech startups are BioInnovate spin-outs. So not only are we having a huge impact in terms of intellectual property generation, but also the patients treated, companies formed, and funding. And obviously, I guess funding probably being a thermometer for how successful all of these companies are and can be. So if I haven't convinced you at this stage, I don't know what I can do, because to me it's a no-brainer as to why everybody who's on the webinar this evening should apply. But just to summarize, really, you have an unrivaled opportunity to accelerate your career. As I said, I came from patient-facing clinical practice to now, being very far advanced in clinical trials for a medtech spin out with a major multinational, huge amount of money raised, biggest orthopedic funding round ever, and really impacting patients clinically with great clinical outcomes. So BioInnovate can put your career on a really, really positive trajectory. Second of all, the program has huge proven success. And that's through the really hard work and diligence of the program team, who have lived all of this themselves and have worked with program companies every single day and program participants every single day. So, that's all that hard work has gone into this proven program success. And if you're fortunate enough to be a fellow, that team will be there to support you as much as possible. Lastly, to drive medical innovation, I think, what better way to spend your career than improving the lives of patients? BioInnovate gives you a chance to do that, to hugely impact the lives of patients, and even actually to find unmet clinical needs that some people don't even recognize at this stage. So the fact that people get an opportunity to do a 10-month fellowship to drive medical innovation and then bring those skills to improve the lives of patients, again, if those three aren't great reasons to apply for BioInnovate, I don't know what is. In terms of key dates, so obviously the application deadline is coming up February 4th. All applicants will be informed of their status about February 11th. The recruitment day will be Saturday, the 1st of March. Apply just for the recruitment day. It is a fascinating, fun, entertaining, informative, thought-provoking day. So it's very, very enjoyable, and everybody says that they did it, really enjoyed it. For those that are successful, they'll be notified about late March. Obviously, the team will have to go through some of the admin, including requesting references and whatnot, with a view to then starting the fellowship mid-August. Now, obviously, a caveat is that these dates may have to change plus or minus a couple of days, but that's broadly it. As I said, hopefully at the end of the webinar, all of your questions will be answered. But these are some of the contacts for the Executive Director, Martin O'Halloran, Director of Operations, Sinead Walsh, Operations Manager, Ailish Walsh, and then for general information, info@bioinnovate.ie. I think the fact that the program team are putting up their email addresses for direct email as well really goes to show the level of commitment from the program team, which obviously then has led to such a program success. So at this stage, I want everyone to take out their phones. If you haven't already clicked on the appropriate links and whatnot, if you haven't already started your application process, and scan the QR code or go straight to BioInnovate and onto the apply and get that application in, because we want as many people to apply as possible. And, it's such a fantastic program. And what have you got to lose? Even the application process in itself is informative and educational and really interesting. So please do go and apply. But as I said, an N of 1 is not always the best. So I've very kindly been joined by Dr. Áine Rafferty, Stephen Geoghegan, and Sarusha, who will give us an idea as to their own experiences and hopefully by hearing their stories, you can see that there's multiple ways that by participating in the BioInnovate Fellowship, that you can really become a healthcare visionary and really positively impact patients' lives. So to that end, I think I have Áine, Sarusha, and Stephen who's joining me. So perhaps Áine, if I start with you, I might start with you first, and I'm going to just ask you, as in, can you tell me a little bit about yourself and how you chose to become a BioInnovate Fellow?
Thanks, Brendan, and hello everybody online. My name is Dr. Áine Rafferty. You can call me Áine. Thanks for giving up your evening today to come see us all. We really appreciate it. And thank you, Brendan, for that lovely introduction. There's many of the themes there that you've touched on that I will too be speaking about. So one of the reasons why I chose to do the BioInnovate programme was because I wanted to help more people than what was expected of the standard trajectory of a doctor. I wanted to impact people locally and regionally and globally. I wanted to use my clinical experience for innovation and to improve patient outcomes. I've been a doctor now for 10 years and been practicing in the UK and Ireland. One of my roles was as a clinical educator, teaching students, student doctors, young doctors, senior doctors, and I also had a role in assessing doctors from overseas for the medical licensing exam in the UK, and I was a regional teacher for 2 different training programs, as well as my clinical role as a GP in the urgent care and the out of hour setting. So, I recognise that navigating multiple roles inside and outside the home can be tricky at times, and I understand the pressures that there are to balance professional ambition with your personal responsibility, such as a family. And it was a big decision for me to step away from my clinical role for 10 months and relocate my family to Galway, but I couldn't deny this unique opportunity that Galway offered me. Relocation has its own challenges, and without the support of my husband, who also is a clinician, a GP himself, in digital health, and without his help and support, I wouldn't have been able to take part in this program. I have to look after my 1-year-old, so he is taking that responsibility this year, and also my family. My local family in the area as well, my aunt and uncle, and my family back home in County Armagh. Without that, I couldn't have come here. So it's been a joint effort really. But I had to come here because I knew how dynamic and collaborative the BioInnovate programme was, and I want to inspire other doctors, to think beyond the traditional paths and just embrace all possibilities that are given to you. So many of the themes that you've mentioned, Brendan, to be honest.
Yeah, no, it's great. And in fair play to you, Áine, because I know like that as in leaving a medical career is challenging enough. And I think like that I as a clinician who's done something similar, it's only really when you get into it that the kind of blinkers of clinical practice can come off and you can really see all of the other elements that makes up healthcare. So I guess from my point of view, perhaps one thing that surprised me a little bit was that, healthcare is a business. The finance of healthcare probably surprised me a little bit. So from your point of view, I know you're very early within the BioInnovate program, really as in kind of haven't started in this year's cohort, but has anything surprised you so far?
I agree with what you've said there. The blinkers have now come off and I'm racing about. So one of my biggest surprises, Brendan, was that the diversity of the team. So, I'm very lucky. I'm in the hypertension team this year and I'm surrounded by great innovators. So we have engineers in our team, but in our wider 12, we have folks from the automotive industry. We've got medical device engineers, biomedical, IT. We've even got folks from Google. We've got business experts. We've got those from consultancy backgrounds, leadership coaches, commercial sector, and we've got clinicians, all range of folks. So physios, speech and language therapists, and those from the pharma background too. Each discipline has their own problem-solving techniques, and these are different perspectives that can merge and then create innovation in itself. And I've now realised myself, Brendan, how valuable my own clinical insights are, and how that can impact and change the way in which something is innovated. And I find that, it's a shock, particularly with seeing that healthcare is now a business, coming from the NHS, that, everything's for free. So it has to be a need that is, something impactful, but it needs to be a business. We need to pay folk too for their time and their expertise.
And Áine, on that, as in you talk about things being impactful. Again, I don't want to put you on the spot given the fact that you're kind of halfway through the program, but is there, what would be the kind of thing that you'd specifically hope to get from the BioInnovate program? Halfway through the rest of the program to go, the background in clinical medicine and like that, as in talking about the impact that clinicians want to make. and even perhaps, you know, people who are tuning in who aren't clinicians, as in what's really maybe the primary aim of gain for you for the program?
Yeah, so aim and game. So we're halfway through, and I know this has been recorded, but my aim and gain is I want to aim for a commercialization fund. So the need that I have, and with my team, that we're trying to basically try and kill, inverted commas, is I want to bring one of those needs to commercialization. And what I've gained from the program itself is it's one of our professors, Mark, said right at the start of the program is that everyone can innovate. And I think that's a key thing that we need to hold on to, that it doesn't matter what your background is or what experience that you have, that it's very much lifted up in the BioInnovate program and pushed forward to promote dynamic thinking and teamwork. I'm also gaining how to do and learn how the needs-led innovation process is done. So identifying unmet clinical needs and then navigating that through the commercial pathways, developing new technologies, and including other things that I've never really thought about, Brendan. I'm sure you can relate, like policy and regulation and how that impacts your device. I also want to influence healthcare on a systematic level too. So I hope to inspire other folks to come forward, particularly in the clinical background, to explore leadership in a different way that's perhaps not as hierarchical that we would experience in healthcare, from our accreditations from uni and things and postgraduate qualifications, and to take on this innovative role and just break away from the average expected medical pathways and trajectories. Things I've been thinking about recently this past week or two is probably yourself as the individual who wants to apply for BioInnovate. You know, the biggest barriers that we face as innovators is perhaps ourselves. So overcoming that self-doubt is the key for anyone taking these steps forward to start into new opportunities. So everyone brings something unique to the table, and that's why it drives innovation forward.
And I think only that's a super point to end our short conversation on, is that to overcome the self-doubt, because everyone brings a unique element to it, but that anyone can innovate, but that innovation is then supported by knowing how to use the biodesign process. So you can put guardrails around it and you can learn the actual skill of innovation so that you have the maximal impact. So Áine, thanks so much for joining us this evening. And like that, I think everybody is enthused, particularly from a clinical point of view. So to that end, Stephen, if you don't mind, if I'll come to you based on, you know, who's most recent to the furthest along. So Stephen, I could trouble you to introduce yourself, tell me a little bit about your background, and then tell me why you chose to do BioInnovate.
Yeah, sure. So my name's Stephen Geoghegan. So my academic background was in biomedical sciences and translational research. So I spent most of my career in industry, in R&D and clinical research, and I worked mostly in pharmaceutical companies. And I ended up joining a startup in Dublin back in 2016, I think it was, and it was pure chaos. And everyone had 2 or 3 different jobs they had to look after, and I absolutely loved it. I think those kind of situations really present a great opportunity, especially for people who maybe want to accelerate their career. So during my time there, I met someone who told me about the BioInnovate program. I hadn't heard of it, not being from a medical devices background at the time, and they put me in contact with a former fellow who I spoke to about it, and yeah, I just fell in love with the idea. I didn't think there was any other opportunity like that, not just in Ireland, but in Europe, to go and be able to, I fundamentally wanted to have my own startup. So this seemed like the ideal setup to do that. You're given all the tools, all the support you can get. So so I'd moved from originally being working in R&D, and I was actually in that startup. I ended up transitioning into business intelligence, data analytics. So it was a different move to go into this kind of this world, but yeah, absolutely no regrets.
Good, but then you went into this world the whole hog. You're a startup founder, and you've gone down the startup route. Tell us all about the exciting stuff that you're doing now that you've made that big leap.
Yeah, sure. Yeah. So I finished the program back in 2020, and myself and one of my teammates came up with an idea and a concept solution. And we ended up getting commercialization funding to go after that. So what we're developing are computer vision based devices that will help surgeons when they're performing surgery in cancer, and any kind of interventionists performing procedures like biopsies in cancer. So essentially, you have this problem where you don't necessarily know if a procedure has been successful until a couple of days later when the pathologist has had a look at the tissue that's been excised. So we're developing devices now that can do that in real time during the procedures, to try and avoid that risk of having to repeat these procedures down the line, avoid those costs, avoid the complications for patients. So that's what we're working on. And we got our commercialization fund. We wanted to build out the founding team at the start. We kind of wanted the different technological areas to be covered. So myself, my background, I suppose, is commercial. And my other co-founder, Salim, who I did the program with, is an oncologist. So we wanted to go and get some technologists on board. So we ended up, one of the people who was brought in by Enterprise Ireland to vet our idea was a computer vision specialist, and he was that interested in the idea that we convinced him to come on board, be our technical lead, and we also added a great hardware engineer to the team. So we've been working on that up until the end of last year. Our commercialization funding ended in UCD. And now we're in the process of spinning out and hopefully raising a seed round in the next couple of months where we can bring this forward and bring our devices to market.
Which is phenomenal, as in, because Stephen, I know the problem that you're trying to solve has a huge patient impact in terms of shortening that timeline. Like that really impacts patients' care and treatment. So I guess as in from my point of view, fair play to you, as in it's a really cool thing to be trying to solve and improve. But it sounds like, I know we have you on as a guest, but that kind of really great BioInnovate element of being able to identify an unmet clinical need, finding a co-founder who has really relevant experience, finding a technical lead from within the ecosystem, getting financial support through BioInnovate, and then follow-on support through Enterprise Ireland. In terms of that, as in, it sounds like it's a really positive story, which I think people tuning into the webinar today will be really interested in. And particularly, as I said, fundamentally, we really want to impact positively on patients' lives. In terms of, and I'll close out for this question, in terms of BioInnovate and the BioInnovate process, what do you reckon was and I know this is a bit of a tough one, Stephen, because I'm sure there was a million different learnings, but what do you reckon was the one key learning that maybe you would have taken from BioInnovate that, either you think would be relevant to the webinar listeners today, or just kind of your own learning and how it changed your career path?
Yeah, I think it's probably mostly fed by that needs-led approach. You need to embed yourself in that kind of perspective of your end user, whether that's a clinician or a patient or any kind of HCP. It's really, if you can get a grip on that need, you understand the workflow, all the different stakeholders, how they'll be affected if you solve this problem this way. If you can get a grip on that and you really understand it and you have all that lined up, everything else isn't guaranteed to fall into place, but it's the best situation you can put yourself in. So it gives you this kind of lens that you can view these opportunities through, and you can kind of analyze them quite quickly, and it gives you a very good idea on the potential success of opportunities like that. So I think that's really where BioInnovate has impacted me the most. And obviously, in addition, as you said, the access to clinicians that you get, you can create these great feedback loops with your end users and constantly iterate, fail forward, fail quickly if you're going to do something wrong. Yeah, I think that's the most valuable thing if I had to pick one.
Brilliant, brilliant. Well, Stephen, thanks so much again for your time. And like that, as in, I know the participants love to hear people's experiences and their stories and the proof of how successful BioInnovate has been. And it's great to have people talking as opposed to just me putting up slides. So, Stephen, thanks again. And to that end, then, Sarusha, I'll come to you because you also have a really interesting story in terms of your BioInnovate process. So like that, as I had asked Stephen, if you can just give us a short background and why did you choose to become a BioInnovate Fellow?
Hi, Brendan, and a warm welcome to everybody on the call. Yes, so very briefly, my career spans about 25 years at this stage, and it started in the pharmaceutical industry. So my undergrad is in pharmacy, and for the first 8 years, I worked in various pharmaceutical companies, all generic manufacturing. I did a lot of quality assurance, regulatory affairs, manufacturing tech transfer, international auditing. I did my MBA in business strategy, and then I then worked for a national funding agency in South Africa, where I identified projects and companies, and I did the commercial appraisal of those opportunities and made investment recommendations. I then found out about BioInnovate through my professional networks, and at that stage, I was looking for a career change. I was looking for a challenge, and I was looking for an international work experience. So I researched BioInnovate more deeply, and I spoke to a few people that knew the program and sought some guidance about what the program was about. I also then researched Ireland, and I realized that Ireland's really a hotspot for medtech innovation. The ecosystem is thriving, lots of entrepreneurs, and lots of success stories. So as a result, I made the decision to apply for the program. And I think what really won me over was actually the application process. And it's interesting that you mentioned that, because I really enjoyed interacting with the administration of BioInnovate. I enjoyed the interview process. I enjoyed the interviewers. And I thought to myself, if I get selected, I would pursue this opportunity, which I did. And that's how I came to the program, and I spent my 10 months in Galway, and I've never looked back. I also saw it as an opportunity to segue into a specific industry, and I didn't know how it was going to end, but I thought, well, here's an opportunity for a new career path, and I trusted that.
Fantastic. And you know, the fact that you relocated from South Africa, I
did.
think in the midst of COVID was kind of
I
all
did.
still going around. And like that, coming from your own very impressive existing career to make that change, I guess, you know, courage has become a word that's thrown around a lot recently, but I think obviously that courage hopefully has been rewarded. And to that end, as in, I won't name names, but I know you started a new role in a major ortho medtech company recently, a very impressive role, and one from an ortho background, I'd find, you know, would be very exciting position to be in. But I suppose what I'd be interested in terms of the BioInnovate webinar this evening is, can you maybe explain how the skills that you gained in BioInnovate have helped you? And I guess ultimately will hopefully continue, or will assuredly continue to help you in your career journey, because like that, as in your career to date has been very impressive, and then obviously hopefully BioInnovate has added to it, and you know your most recent position is extremely impressive. So it'd be really interesting to hear how those skills have helped and how you hope to bring them forward as well.
The one thing I want to say, I suppose, to some of the listeners on the call is that the skills you learn in BioInnovate are highly transferable. Even though it's medical device focused, it is actually quite generic in its nature, in the sense that you can take it and apply it to different areas, whether it be academia, whether it be entrepreneurship, industry, and even some of the softer skills that you learn in the program around teamwork and collaboration, influence, how to speak to stakeholders. All of those skills contribute towards the bigger picture. I myself now work, like you've mentioned, for a multinational medical device company. And I honestly believe that the last 4 years of my career, which I've spent actually on a commercialization grant myself. So after leaving BioInnovate, I worked with a clinician in Cork Maternity Hospital. We put in an application to Enterprise Ireland, and we were awarded some grant funding. And for 3 years after BioInnovate, I pursued that opportunity as an entrepreneur, and I learned an immense amount around pre-spin out entrepreneurships, further developing technology, to proof of concepts, understanding the startup ecosystem. I chose to take a different path from entrepreneurship, but I suppose what's important is to see the transition between a choice from BioInnovate into entrepreneurship into industry. It was easily carried across those skills.
Indeed, and I guess that's what I find fantastic about the BioInnovate program is really that education in the biodesign process to educate the next generation of healthcare visionaries, and whether that's a spin out like Stephen, or bringing that kind of visionary leadership into a multinational, all really impacts patient care across locally in Ireland and across the world. So I think it's a fantastic example of how BioInnovate and that process can positively impact patient outcomes in a multitude of various different situations and circumstances, locations and industries. So to that end, Sarusha, if you don't mind, it might be, if you don't mind unfairness, that I'll ask you the same question that I asked Stephen, because I think it's really interesting always to hear various different people's takes on the same question. And that's, what's the one key learning that you took from your time in BioInnovate that I think really, that you might kind of say really stands out and was probably the most key impactful learning that you took from the 10 months?
Don't ever underestimate the power of networking and collaboration. I think that's the one thing that has held me in good stead. It's the one thing that has really made my career advance. It's the one thing that made opportunities open for me. Ireland is an amazing ecosystem. There's a lot of goodwill into it. Everybody will give you half an hour for a cup of coffee. And I think anyone that's interested in the program needs to be able to leverage off that and understand the stakeholders, understand the ecosystems, and don't be afraid to put yourself out there. I learned that in BioInnovate, and honestly, it's the one thing that I've carried with me ever since.
Brilliant. Well, Sarusha, thank you so much again for taking the time to talk to us. And like that, as I said at the start of this section, if people hadn't already been convinced to do BioInnovate, I think talking to yourself and Áine and Stephen hopefully should really convince people to go ahead and click and apply. And I guess like that, listening to the three panelists coming from quite diverse backgrounds, all bringing really interesting, positive, unique skills to their own teams, and then achieving huge successes, in their own right, from all of the impacts that they can have coming out of BioInnovate, just goes to show what a positive, impactful program BioInnovate is. Now, turning to the more practical elements, I know we've been running a kind of a Q&A in parallel to this evening's conversation. So I know Ailish has been very kindly answering questions as we go. So I think Ailish, Martin and Sinead are going to rejoin us now just for the last couple of minutes to run over any of the questions that they may have. Ailish, I might briefly come to you first to kind of maybe touch on some of the questions and answers that have been run through. I know you've been answering them, as has Martin. So perhaps, Ailish, if I come to you first and then I'll come to Martin, and then maybe I'll close out with Sinead, who can touch on anything that, key elements that need to be highlighted that we haven't touched on so far. So Ailish, what's been coming in off the presses while we've been nattering away here?
Thanks a million, and thanks for all the questions that have come through so far, and please keep putting questions through. And also, if you have any questions for the panelists as well, you can throw them in there. We can ask Brendan, Sarusha, Stephen and Áine. But I suppose one that's come up that I think Martin might be able to expand on is the opportunities that come up after the program. So a lot of people are interested in that. So
yeah, so I think it's interesting because there's a couple of questions about what percentage of our fellows go into startup companies, or yeah, where do our fellows end up? So about half have started their own company. So we've now 33 companies that have come from the program, and they are growing and scaling. And if people want to learn more about them, I would say Google some of our alumni companies. I think they speak more about the process than we ever could. It's really unusual that we have 33 companies over 13 years that are all still alive, growing and scaling. And I think that's a testament to the quality of the people that we get in. The other thing which we probably talk less about is the other 50% and what they do. That skill set of being able to critique clinical needs and identify business opportunities is actually quite rare in medtech. And so a lot of our alumni get taken up by medtech who want to build their innovation capacity. And I think our speakers this evening are great examples of that. Then we have others who go back into clinical practice, but with, I think, a whole new skill set and a whole understanding of business development. So I think, yeah, I think there's a lot of rich careers for our alumni. But I think what you're doing is you're creating a paradigm shift in how you look at innovation. You're coming in with a complete different skill set. There's another point which I think that we haven't touched on is there's something really great about working with 12 or 11 other excellent people when you're in the program. The process is great, but it's only great because of the talented people we get in. And I think it's a really nice opportunity to work with 11 other high-performing, driven, motivated people who want to impact healthcare for a year. And it's definitely one of the nicest parts of my job as academic director.
Indeed, and sorry, Ailish, just before I come back to you, I'll jump in there as in, so the co-founder of the company with me was Jerry Clark, who was coming from a background of 35, almost 40 years in medtech. There was no way I was going to be able to find someone like that to work with and start a company with. It's practically impossible, and like that, to be able to work with such talented people, I think just is a phenomenal benefit to BioInnovate. So I had to jump in there, Martin, because like that, as in, wouldn't be where we were today if it wasn't that great team mix, and as you say, extending out to the other fellows on the other teams as well, and all of their skill set that you can lean into. Sorry, Ailish, as if I haven't
No,
talked
you're
enough.
fine.
As if I haven't talked enough, I'm now jumping in as well on Martin's comments. So apologies, Ailish.
So I think, oh, Sinead has something to say, actually.
Well, I was just going to add in there, I suppose, for the benefit of some of the people listening, like an example of some of the other diverse careers that some of the alumni have gone into. And Sarusha is obviously a great example of someone who's come into the program and is now using the skills that she's developed over the last number of years in a really kind of exciting director of RD&I role in a major multinational. But there are others as well. So some of the alumni have gone on to become partners in VC and venture capital firms. Others have gone on to senior directorship roles in major organizations like IDA. Others have gone on to set up their own kind of legal firm with kind of a niche kind of audience. And there's a whole series of different, I suppose, career paths that we've seen people go into. Equally, as the ecosystem is developing, there's a trend towards people having the opportunity as well to take on really exciting innovation roles within startups, within other startups in the space. So we've seen that happen as well, where people, they may not want to start their own company, but they like that buzz of working in a really innovative space. And so we've seen a lot of alumni now go in as clinical director, for example, or doing some R&D work or whatever the case may be. And kind of really, taking off with their career through other startups that are maybe emerging. So there's just a few examples, I suppose, of other careers that people can go into. And really that diversity is just getting broader and broader as the program develops over time.
Thanks, Sinead. There's a number of questions as well from international candidates, which is great to see so many international people online. Do you have any advice to give those that are considering applying from other countries? Don't know, Sinead or Martin, whoever wants to take that one.
Go ahead, Sinead.
Yeah, I suppose, like, we really want a diversity of people coming into the program. So we want to have people from lots of different backgrounds, from different sectors. And equally, we're really interested in bringing people from different countries. And every year we have, on average, about 2 international candidates on the program every year. It brings, a different way of thinking. So I'd really encourage anybody, whether you're based in Ireland or whether you're from Ireland living abroad, or whether you're living internationally and think this might be a good opportunity for you, definitely apply. you know, if for any reason that you wouldn't be able to travel, for example, internationally for our recruitment day, we can work with you on that. As Brendan said at the very start, we really aim to be very flexible. We want the best candidates, the best minds, the best kind of leadership potential to come into the program, you know, from across a whole range of different areas. Of course, there might be a few additional kind of barriers, I suppose, coming internationally, and we'll try and help you, I suppose, to overcome those. And I suppose the key would be to really apply early, and, you know, maybe get in contact with us early so that we can identify if you need help or support, for example, with visa issues or accommodation or anything like that. And we have a great international office here at the University of Galway as well, which is able to support international candidates who are interested in coming over to do programs here. That's one element in terms of internationals. And I would say just in terms of that leadership piece, actually, that Sarusha kind of alluded to, is that we don't expect people to come in and already be fully rounded leaders. What we're looking for is people who have a burning ambition to work in innovation and to, you know, really impact the lives of other people in the health space. And that could be really, really broad. And what we're looking for is people who have that leadership potential. And one thing that we also offer during the course of the program, I think, which is quite unique, is executive coaching and leadership development throughout the program. And that's really aimed to support the individual. So you as an individual coming into the program to really realize the kind of the leadership that you have within you, so that at the end of the program that you're kind of ready to really to leap into your next part of your career. And also support to work as a team. It can be tricky when we have kind of 12 leaders in a program, and you know, it can you know, bring up challenges that ultimately end in kind of really good innovations. But we have that executive coaching support there to help the teams and the individuals come on the program to work through that journey and ultimately then come out with the best possible innovations with input from everybody and all different voices on the teams.
And just to jump in there for a second, Sinead, I think that's kind of part of what I was referring to, is how hard the program team works with the teams. And I think that's kind of a evidence then in the success of the spin-outs, because like that, everybody has a place on the team. Leadership can be in many different ways, shapes and forms, and everybody can bring something really positive to the team. And I think the program support, coupled with that, as well as kind of formal support and informal ecosystem support, then kind of leads to such a successful outcomes for everybody's career. So again, to echo it, having gone through the program myself, as in there is a place for everybody on it. So again, to really encourage people to apply. If don't have any self-doubts, go ahead, and there's only one way to find out if you're BioInnovate material, and that's to get your application in there.
Thanks, Brendan. That seems to be all the themes that have come through the Q&A, unless Martin and Sinead has something else to add. I might hand it back to you to close us out. Oh, there's another one there about recruitment day. Maybe I'll hand that over to you, Martin.
Yeah, so we do a very thorough recruitment process, which happens over a full day. And what we try and do is to do a very mini version of the program. So we will be asking people to observe a clinical scenario and identify potential problems or inefficiencies and potentially develop solutions to those problems. We'll also be assessing your leadership ability or your coachability as well in a series of interviews. But I guess just to reassure people, we're not really trying to catch people out in those interviews, even though they're thorough. We're trying to catch people in. We're trying to find if they're a good fit for the program and the program's a good fit for them. But like I would say to people, the fact that you're on this webinar is such a good sign that you're already putting in the effort. We're looking for driven, motivated people. And so I'd love to see as many of our attendees converting into applicants, because for me, you've already passed the first test of being driven, being interested, and being motivated. So looking forward to seeing some of those applications coming in.
Great stuff. Well, Martin, thanks a million. And I think that's a really nice way to kind of wrap up Sinead, Ailish, obviously, you know, fantastic program support, and I think we've covered a huge amount of questions as well. To Áine, Stephen, and Sarusha, thanks so much again for being panelists. And finally, thanks so much for everybody who has tuned in this evening. As I said, I can't think of any reason why you wouldn't apply for BioInnovate. So up on screen there now should be the QR code, and go on to BioInnovate. The email addresses have already gone up, and obviously, like that, this webinar has been recorded, so will be available to look back on, or to pass on to any colleagues who you think might be interested as well. So sincerest thanks to everybody for tuning in this evening, and I wish you all the very best of luck in your applications. Take care and have a very good night.